Izote is the national flower of El Salvador, and it only grows in Central America. And the bud of the Izote is used in the pupusa, which is the national dish of El Salvador.
Lisa and I decided to focus our work on healthcare and literacy and some of the ecological problems that were going on in El Salvador.
Louise and I have known each other all our lives. We had decided to do an overseas service trip because we were both registered nurses, but unfortunately Louise wasn't able to make it, so I went on the first trip with another organization by myself. We did medical clinics at various primary schools in different communities in different areas of rural El Salvador, and what I was struck by is that none of these schools had any books for the kids. One aspect of the clinics that we did was giving out reading glasses to people. But one thing we encountered was that many of those people had cataracts, and there was no cataract care available in El Salvador for poor people.
Risa came back very upset with what was going on there and said, we've got to do more. And in discussion, we decided to focus our work on healthcare and literacy and some of the ecological problems that were going on.
The core of Izote's literacy project is setting up sustainable libraries.
There were no books in these schools, and these children were never going to get out of the poverty until they had the ability to learn and do better than their parents.
First thing we did is sent down a mountain of books. We divided those books in various areas in El Salvador in many different primary schools. For the first time ever, kids are able to take books home where we've created some of these libraries. And so the parents are actually coming in saying, my kid needs another book, because the kids are reading to the parents at night. Our next step has been funding training, which has been incredible. We needed trainings for the teachers to use the books and interest the kids in the books. Step 3, as we've seen in some of the schools, they really don't have an adequate space for the books. They don't have shelving, they don't have a protected area, so that's what we're working on funding now. Groups have sent down books in the past, over the past 50 years, but what the books did is they got warehoused, they got locked in the principal's office, they had to protect the books. So what we're trying to be part of is changing to a culture of reading, a culture of reading, of love of books, and that's the need there. The World Health Organization has stated that cataract surgery is the #1 bang for your buck for public health dollars, because it's a quick surgery that returns eyesight to an eye that has been blinded by a cataract.
There was many people who were blinded by cataracts, and they were waiting on lists for 10 years to be helped.
The first step was finding a Salvadoran doctor to work with, because the key to everything that we're doing is sustainability. So we didn't just want to fly U.S. doctors over there, we wanted to create a doctor over there who would work with us on an ongoing basis. We found that doctor, Dr. Rafael Lopez, who worked in a rural hospital.
He was trying his best to try and do whatever eye care he could do, but he was missing much of the equipment that he needed. So that was our first step, was to try and get him equipped.
We did some wonderful fundraisers, and we equipped the operating room with all the surgical instruments he needed, with the operating microscope, which is a big contraption that's needed for cataract surgery, and away we went. Since we got the operating room up and running, Izote has gone down on 2 cataract surgery missions. 2 surgical teams were going side by side, the Izote US team and the Salvadoran team, and it was amazing. Our most recent venture has been funding an ambulatory surgery unit in the hospital that we've been working in. We had 2 nurses that Izote funded for the past year that have been specially trained to work with Dr. Lopez and are now on staff thanks to Izote.
People in the world who have so little could use so much, and it takes just one hand to reach another hand to make that happen.
One of the Salvadoran nonprofits that we partner with on the book project and the cataract surgery project also had an ongoing sea turtle preservation project.
There's a beautiful bay of Jiquilisco there that has sea turtles, and because of the poverty there, the turtle men would steal the eggs from the turtles and sell them because they're a delicacy to the more affluent people. And over time, these sea turtles were becoming extinct.
In this project, they paid local people to collect the turtle eggs, bury them in the ground in hatcheries that were protected by a fence, and release them when the turtles were finished incubating. Those same people who are running the turtle hatcheries and collecting the eggs to protect them in the past would collect the eggs to sell them to market for the eggs to be eaten as a delicacy. This was such a wonderful, sustainable, ecological project for Izote to jump into that we had to take the opportunity. So far, we've been able to initiate about 20 school libraries. Our goal is to make sure those libraries are up, running, and sustainable and integrated into the schools. The goal for the cataract surgery projects is that more and more hospitals would join what we've initiated and that it be part of the public health system. As far as the turtles, there would be an ecological tourism component to it, so it could really be self-supporting.
It doesn't matter where a person is. It doesn't matter if they're around the corner or in El Salvador. It's just equally as important. You're putting yourself out there in the world and helping someone else.
Izote is run totally by volunteers. We don't have any staff members, and all the donations are going directly to fund our projects.
It takes so little here financially to do so much there.
We hope people will continue to be as generous and supportive as they have been, so that we can continue the wonderful sustainable projects that we've initiated in El Salvador.